I would be covering my topic from crisis to resilience, rethinking pandemic response strategies. And this is purely a article which is after gaining after insights of too many references of COVID pandemic responses through various global responses available. Next slide, please. Yeah. So the world has witnessed numerous pandemics throughout the history, each posing unique challenges. And the most recent and prominent example of COVID-19 pandemic, which we have already faced throughout 2020 to almost the early 2021. And this pandemic has demonstrated an effective crisis management, which is not merely an option, but an absolute necessity. So, the present study will explore the need for comprehensive pandemic crisis management strategies, drawing insights from the COVID-19 crisis and examining the broader implications for future pandemic preparedness. We have learned some lessons through this pandemic, and here's an insight. Next slide, please. Yeah. So, what we have undergone is a delayed response to the pandemic, which is in context refers to a situation where the government authorities, the healthcare systems, and the other relevant entities did not take swift and effective action in response to the emerging early signs of the pandemic. This delay can have significant negative consequences, as timely responses are crucial to controlling the spread of the disease and mitigating its impact. The implications of the delayed response are increased transmission, which have allowed the virus to spread more rapidly within the communities, regions, and even globally. This results in higher number of infected individuals, making containment and control more challenging. Overwhelmed healthcare systems, which have led to a surge in the hospitalizations, straining the healthcare facilities and resources. These have struggled to provide adequate care, leading to increased morbidity and mortality. Economic impact due to delayed responses have prolonged the duration of a pandemic, causing more extended disruptions to economies. Lockdowns and restrictions have placed a longer impact on businesses and employment. The public panic due to the government's slow responses and public uncertainty and escalated. In the absence of clear guidance from the and governance, people have resorted to panic buying and leading to shortages of essential subsidies. The inadequate preparedness due to the COVID-19 pandemic has exposed shortcomings in the global preparedness. This emphasizes the need for investment in research, development, and healthcare infrastructure. Adequate preparedness is essential for mitigating the impact of the pandemic, and inadequate preparedness can lead to increased morbidity, mortality, and socio-economic disruption. The shortages of critical resources have led to lack of PPEs, diagnostic kits, ventilators, and medical supplies. This has led to strain on the healthcare systems and hinder the patient cares. The economic impact, of course, we have already discussed, and due to this, there is a need for preparedness, which includes stockpiling medical supplies and establishing surveillance systems. To counteract this, we need anticipation and readiness. Pre-pandemic planning involves anticipating the possibility of the pandemic outbreak and developing comprehensive strategies to address it. This includes creating networks, guidelines, and coordination mechanisms that are ready to be activated as soon as a threat is identified. Without pre-pandemic planning, governments and healthcare systems might be caught off guard leading to delayed responses and potentially catastrophic consequences. Early detection and surveillance mechanisms have to be in place, and for this, investments in health and track the spread of potential pathogen swiftly. Early detection is crucial for implementing containment measures and preventing the virus from spreading unchecked. The rapid response capability should be well defined, structured, and in place, establishing emergency response teams, stockpiling necessary medical supplies, and designating healthcare facilities for the treatment of the infectious diseases. This infrastructure allows for a rapid response when a pandemic is confirmed, reducing the risk of overwhelmed healthcare systems. There is a need for public awareness and education. Pre-pandemic planning includes educational camps and awareness strategies that prepare the public for a potential pandemic. Educated citizens are more likely to adhere to the public health recommendations such as social distancing and mask wearing, which are critical in slowing the spread of the infectious diseases. Cost efficiencies, while investing in the pre-pandemic planning and healthcare infrastructure may require financial resources, it can be cost effective in the long run. The economic and the social costs of unpreparedness during the pandemic, including the loss of life, strain on the healthcare systems, and economic disruption, often outweigh the initial investment in preparedness. Global health security is highly interconnected and not only the national concern but a global one. By investing in the preparedness, healthcare infrastructures, nations contribute to the global health security. They can share best practices, knowledge, and resources to help other countries during the pandemics and reduce risk of global outbreaks. The need for a governance and leadership is very important. This is crucial for coordinating efforts, making informed decisions, and ensuring a cohesive and efficient response to pandemics. Coordinated response is ensuring that there is a centralized authority responsible for coordinating the response to the pandemic, and it enables different government agencies and the organizations together with the stakeholders to work together with a unified strategy. Without this central authority, responses may become inefficient and less effective. So data-driven decision-making is the need of the hour. Governance depends on the data-driven decision-making, which ensures that the policymakers have access to the real-time accurate information about the pandemic's progression. Data-driven decision-making allows leaders to respond quickly and make informed choices about implementing interventions, allocating resources, and adjusting the strategies. There is a need for resource allocation, and the leadership is responsible for allocating the resources, including the healthcare facilities having sufficient supplies of PPEs, ventilators, and the necessary medications. Leaders must make difficult decisions about resource distributions, often prioritizing areas with the most crucial need. Policy development and implementation is necessary in a pandemic situation, and public health messaging systems should convey the importance of adhering to the public health guidelines and the rationale behind them. Effective public health messaging influences public behavior and encouraging compliance with recommended measures. The crisis adaptability enables to respond to evolving situations during the pandemic.
Sorry
New
to interrupt you,
information.
doctor.
Pardon me?
Yes, we are on the correct slide. Can you please
Yeah.
press once?
Yeah, we are on the correct crisis adaptability. We are on the correct slide.
No, we are on the governance and leadership slide.
Yeah, so governance and leadership, crisis adaptability.
Yes, perfect. Okay, now.
Yeah.
Can you please once mention next slides when you want to move the next slide?
Yeah, sure. Yeah. These are the subheadings and I'm just explaining them.
Thank you. Please continue.
So leaders must be adaptable and able to respond to the evolving situations during the pandemic, wherein the new information about the virus, its transmission, and the effectiveness of interventions may emerge. The governance should also allow flexibility in strategies and ability to adjust policies in real time based on the latest evidence. International collaboration helps us and the other nations to share information, resources, and best practices. Effective leaders build diplomatic ties and relationship partnership to tackle the pandemics collectively. Addressing equity and vulnerable populations, needs such as elderly, low-income communities, and healthcare workers should be designed to ensure that these groups receive equitable access to healthcare and support. Public trust has to be built in so that the government decisions is critical for compliance with the public health measures and success response. Next slide. Next slide, please. Yeah. The next slide. Yeah. So, in the case of inadequate preparedness, we'll need to have a supply chain resilience. The supply chain resilience is the ability of a supply chain system to adapt to disruptions, whether they are caused by external factors like natural disasters or pandemics, or internal factors such as logistic challenges to supply chain failures. So the key elements of the supply chain resilience are flexibility. Next slide. Yeah. Our flexibility, wherein the supply chains are designed to be flexible and adaptable and can quickly adjust to the changing conditions, whether it's a sudden surge or sudden disruption of the flow of goods. Redundancy in the supply chains often built into the system. This means having alternate suppliers, transportation routes, or manufacturing facilities can be activated when the primary sources are disrupted. Visibility of the supply chain involves having real-time access to information about the status of goods, inventory levels, and location of products in transit. Visibility enables quick decision-making during the disruptions. Risk assessment proactively assesses and manages the risks. This includes identifying potential vulnerabilities and implementing strategies to mitigate risks. The significance of the supply chain resilience will include continuity of the operations to allow the businesses to continue even when they are disrupted. Cost reduction will proactively manage the risks and disruptions and thus impacting the business less reduction. This may include avoiding cost production stoppages and rerouting the shipments to minimize the delays. Regulatory compliances will allow to avoid legal issues and potential fines, and competitive advantage will allow attraction to the customers and the partners and the investments at the large because they are better prepared to handle the disruptions. The most important, the healthcare infrastructure, which needs to be, next slide, which needs to be strengthened, wherein the healthcare facilities, including the hospitals, clinics, long-term care facilities, and institutions providing a range of medical services for primary care and specialized treatments will have to be topped up. Medical equipment and technologies, including diagnostic machines, lab equipments, surgical tools, and telemedicine will have to be pepped up. Healthcare forces will have to be doubled, wherein the infrastructure comprising of doctors, nurses, pharmacists, technicians, and administrative staffs we are well trained and sufficient for care delivery. Access to medications and pharmacies, including antibiotics and life-saving drugs, is also a crucial part of healthcare infrastructure. Healthcare information systems help in documenting patient information, tracking the medical history, and streamlining healthcare delivery. Research and development facilities dedicated for medical research and are vital for advancing healthcare and developing new treatments and technologies. Public healthcare services also encompassing public focus on disease prevention, health education, epidemiological surveillance, and outbreak response. Emergency systems involving ambulances and trained paramedics are integral components that provide rapid medical assistance during emergencies. Healthcare financing and insurance, which support the government healthcare programs and private payment mechanisms, are an essential part of the infrastructure. These can be challenging. Next slide. These can be challenging due to resource allocation issues, aging of the infrastructure, since most of the facilities and technologies are already outdated and in need of renovation or replacement, healthcare disparities, which exist due to access and quality between the different countries. Hence, bridging these gaps is an ongoing challenge. The healthcare costs can strain the infrastructure and pose challenges for individuals and governments. And the need for pandemic preparedness, which needs adequate and well-maintained healthcare infrastructure, responding to emergencies and promoting public health. Hence, we conclude that during the pandemic, which has underscored the critical need of comprehensive pandemic cross-management, effective crisis management involves preparedness, governance, and international collaboration. And the lessons learned during the COVID pandemic serve as valuable insights for future preparedness and efforts. The government and international organizations play key roles in communication, flexibility, and adaptability. We have to meet these challenges for any future pandemics that the world will have to face. Let's all be prepared. Good day and good luck. Thank you.